my name is Emily and today I'm going to be doing EasyPAP. EasyPAP is a positive airway pressure therapy. Some of the indications for this would be a lung expansion as well as a atelectasis and to remove secretions. It could also be used as an aerosol, and some of the contraindications for this would be patient cooperation, and some of the hazards would include barotrauma as well as hyperventilation that could lead to dizziness. So the first thing I'm going to do is I'm going to check my physician's orders, and my physician wants the patient to be able to do 5 to 8 centimeters of water pressure. Now I'm going to introduce myself to the patient. Hi, Mr. Rodriguez. My name is Emily, and I'm going to be your RT student for today. Today I'm going to give you an EasyPAP therapy, and that's just going to help you to remove any secretions as well as help you with your atelectasis. Some of the hazards that could come with this is barotrauma as well as hyperventilation that could lead to a bit of dizziness, okay? I'm going to set everything up and then I'll be right back to take your vitals. Okay, so the equipment I have with me is the EasyPAP and a manometer as well as a mouthpiece and the tubing. The first thing I'm going to do is hand hygiene for 15 seconds. And then I'm going to don my PPE. Now I'm going to set up my equipment. For this therapy, we are going to use 5 to 15 liters. And now before I instruct the patient what to do, I'm going to take vitals. I'm going to check my patient's heart rate, respiratory rate, and SpO2, and I'm going to listen to breath sounds. My patient's breath sounds are diminished, so we're going to do the therapy. So for this therapy, Mr. Rodriguez, I'm going to ask you to take deep breaths, but not deep breaths to your full capacity. Then I'm going to ask you to exhale slowly, okay? I'm going to start the therapy on 5 liters. Okay, we're going to do 4 to 8 sets of 10 to 20 breaths, okay? So let's begin. My patient is done with the first round. Now I'm going to listen to breath sounds. Okay, my patient is still diminished, so we are going to raise this up, and I'm going to ask my patient to hush cough again. I'm going to ask him to hush cough again. Cough, cough. All right, my patient is cough, coughing. Now I'm going to repeat the treatment. 4 to 8 sets and 10 to 20 breaths. The treatment is going to take about 10 to 20 minutes. I'm going to listen to breath sounds again. I'm going to ask him to huff cough again, about 2 to 3 times. And I'm going to check my patient's vital signs, his heart rate, his respiratory rate, and his SpO2. Everything looks good. I'm going to leave the therapy with my patient, and I'm going to ensure patient comfort. I'm going to make sure the rails are up, and I'm going to ask my patient if he needs anything else. Do you need anything else? Okay. Now I'm going to remove my PPE and perform hand hygiene again. And the next thing I'm going to do is I'm going to chart. I'm going to chart my pre and post vitals. I'm going to also chart the patient outcome as well as the procedure, my initials, and the date and the time.